Health officials in British Columbia are expected to announce the return of masking requirements in healthcare settings. That news conference scheduled for next hour, and we, of course, will bring it to you live on CBC News Network. This comes at a time when respiratory illnesses, including COVID-19, are making a seasonal comeback. Let's bring in Sarah Galashan, who joins me now from Coquitlam, BC, for more on this story. Sarah, what are we expecting to hear?
Well, so Hannah, there's a provincial memo that has been sent out to various doctors' offices, and CBC has seen a copy of this from a retired physician who prefers not to be named. But from this memo, we get a pretty good sense of what to expect from this press conference on the part of the health minister and as well the provincial health officer, Dr. Bonnie Henry, next hour. In this memo, they call for continuous masking on the part of healthcare workers, visitors, contractors, and volunteers in all patient, client, and residential care areas. So we're talking about hospitals, care homes, physicians' offices, clinics. The memo reads that people will mask when directed by a healthcare worker or based on personal choice, which does suggest that people would be able to choose to not mask. Nowhere in this memo is the word mandate used. And BC's mask mandate for healthcare settings actually lifted back in April of last year. And previously we have heard from Health Minister Adrian Dix to expect enhanced masking be expected in healthcare settings come the fall when you see the return of respiratory illness season, and that is now upon us. But he has always steered clear of using the word mandate, and as I say, that word mandate also not used in this memo. Earlier, News Network spoke with Dr. Brian Conway with the BC Centre for Disease Control, and he thinks not using that word mandate is a wise strategy. Take a listen.
The word mandate speaks of the pandemic, and we're past the pandemic. We're into the endemic part of COVID. And it also raises problems with people. That word is the health authorities are telling me what I need to do, and it brings that into the equation. I think we need to have a conversation about masks. Look, in the long-term care facilities, there are 5 outbreaks in the interior of British Columbia last week. And these are people that if they get COVID could be hospitalized and die. So there are settings where we should be wearing masks.
Sarah, what do we know about COVID transmission right now in BC?
I mean, there's not the same level of testing right now, of course, as we saw during the height of the COVID pandemic. But there is some testing that is going on. And from the BC CDC, we have a 4-week period of data from August 20th to September 16th that does show the number of confirmed cases that they do have has nearly doubled in that period of time from 366 to 628. 178 of those hospitalized in the final week of that data being collected, and the number of deaths going from 10 in the first week to 22 in the last week. We are expecting there's going to be more data presented at this press conference by Dr. Bonnie Henry. We know that there's been wastewater sampling that is done that helps to back up or show transmission levels in the community. So that's possibly some of what will be presented as they discuss these mask recommendations, encouragements, requirements. We're not exactly sure what the wording is going to be. So everybody will be listening very closely to how this is going to be worded and then what the reaction to it will be. Hannah?
You and I will be watching that and we'll dig into it again. Sarah Galashan, thank you kindly.
You bet.
Want to continue on this discussion and bring in Dr. Anna Wallach. She's a family physician practicing in Vancouver and also a clinical assistant professor at UBC Faculty of Medicine. Dr. Wallach, welcome back to the program. Always appreciate having you on.
Thank you for having me.
So as we heard from Sarah, when it comes to masking in British Columbia in health facilities, a requirement but not mandated. What are your thoughts?
I mean, I think a lot of it is basically a play on words. We know that masks and the word mandate in particular have become quite politicized over the last 3 years. So moving into the gentler sounding requirement, but it's still the same thing. The expectation is that when somebody enters a healthcare setting, be it a hospital or a private physician's office, the expectation is that both the healthcare worker, their staff, and the patient will be masked. And we need this to protect the vulnerable in our society, because there are people who are vulnerable to all sorts of viruses, not just COVID, who have to go to healthcare settings and have to go to the hospital. And this is the best way that we can protect them, especially against the rising number of cases. We also know that we need to protect our healthcare workers, because we need to make sure that we don't fall back into what happened last year, where the healthcare system was practically brought to its knees by the resurgence of all these viruses and affecting both patients and healthcare workers. There is some guidance about what will be happening in long-term care settings, because they are their own category. They are a healthcare setting, but they're also people's homes. And so the expectation there is that staff, healthcare workers, and volunteers will be masked. Visitors to common areas where you are not just with your loved one, but you are with other people, and we don't know their vulnerabilities. Visitors will need to be masked, but in the rooms of the residents, then I think the guidance there is depending on your own symptoms and your own risk factors and the risk factors of your loved ones, and then your own private decision can be made whether you should or should not mask.
So when they say requirement, that means they have to wear them. It's just they're not using the word mandated.
I believe so. I believe that is how the wording is. And that's what we've been told as well, that, it will be required, it will be expected that healthcare workers will be required to wear at least a medical mask in healthcare settings. There was a letter that was leaked yesterday that talked about how patients would need to mask if they were asked to by a healthcare worker. So I think a lot of it is, yes, for all intents and purposes, you will be required to wear a mask if you step foot in any healthcare setting. And I believe that is the best thing that we need to do now as we approach respiratory virus season, and as we see that all viruses cases are rising and people are starting to congregate indoors. So we need to activate that layer of protection of masking, ideally with an N95 respirator or equivalent, because we know that to protect against all the airborne viruses.
Do you feel this is enough?
This is something that I have been calling for, that I don't think that masks should have ever been removed from healthcare settings. I believe that we should have kept it going because of the vulnerability. So I am pleased that this has been brought back. I was worried that there may be some ambiguity around it, but I believe that at this point there's the expectation and the requirement that when you step into a healthcare setting, you will be masked. There were other talks about things like the vaccine rollout and reminders about things like staying home when you're sick and making sure you get tested, and reminding us that there are other viruses apart from COVID, such as flu and RSV, and to make sure that you stay home when sick, because even if it's not COVID, you can still transmit things. We're at the point where the heavy hand of mandates is not, the value of that can be quite detrimental. So now we're having to look at how we can live with what's going on. And I believe that at this point in time, the requirement of masks in healthcare setting is a very good first step. We need to see what will be happening as winter comes on. And a lot of it as well is reminding people to think about their own risks and places they're entering. There are no mandates or requirements to mask in crowded indoor settings, but this is something that people should also be thinking about, whether you need to mask when you're entering pharmacies, or whether you're going on to transit where you don't know people's vulnerabilities, right. You don't know what ventilation is like. So, but it's the requirements for healthcare setting is a good first start, and may serve as a nice reminder to people that, oh, wait, COVID hasn't gone away. Respiratory viruses are on their way. We need to start looking at our behavior again.
Okay, Dr. Anna Wallach, I want to thank you for being on the program and digging into this again with us.
Thank you.